Graduated from North Carolina Central University and has received her Master of Science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born again child of the Most High King.
Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers. We are here every Thursday from 3 to 3:30 p.m. on Awesome Radio 106.9 FM. I'm so glad you are able to join us here on live on the radio and on Facebook and YouTube. So we are glad to have you here. And so we want to jump right in. We got a lot of information to cover, and I've got a new face with me on today, a new guest. Dr. Lydia Best is joining us today, and we're going to be talking about diabetes and diabetes awareness. So, Lydia, thank you so much for being here with us on Family Health Matters.
It is my pleasure to be here.
Great. So we're going to be talking about, we know that November is Diabetes Awareness Month, but as I say about all the months that we talk about or specific things that we should be aware of our health all the time, not just one specific month. But this has been dedicated to diabetes awareness, and we're going to talk about diabetes, and we're going to let Dr. Best speak. I'm going to let her tell you a little bit about herself because this is part of her specialty, and it's my endeavor that I always try to bring guests that has an expertise in these matters, and I'm going to let her share a little bit about herself and why this is so important, and then we're going to jump right on into education about diabetes. So Dr. Best, tell us a little bit about yourself.
Amen. I first of all want to point out that I am a doctor of ministry. I am a retired family nurse practitioner and commander. I was a former commander in the United States Navy where I did a whole lot of things with health care. But I am a diabetes care specialist. And yes, diabetes, I have worked in that area for such a long time, and we have a lot in common. I have been a nurse for over 40 some years, okay? And I went to Winston-Salem State University for my bachelor degree, bachelor of science, and I went to Hampton University for my master's. And then I went to Covenant Theological Seminary for my doctorate, all while I did a little bit of training at Old Dominion University in Virginia. So
Okay.
I've had some experience in a lot of areas, but I still tend to focus more on diabetes, and I am a certified life coach. I work with the Balm and Gilead, where we focus on prevention of type 2 diabetes, and I do classes. Right now, I have three a week for prevention of type 2 diabetes. So we talk a lot about prediabetes. So
Okay.
I am a wife, a mother, a grandmother. They call me Yaya.
Oh, I love it. I love it. See, as I told you guys, our audience, that she has a wealth of knowledge to share with us on today. So we're excited that she's going to be joining us and talking to us. And so we want to dive right in. And I know people say, you hear about diabetes all the time, and it's part of life. Yes, it is. But it's nothing wrong with being reminded and bringing it to our forefront. And so that's what we want to do today, because as I say, with the subject for the topic of my show is Family Health Matters. So the health of the family, it matters continuously. So even though it may be something that's already out there, but it's nothing wrong with being reminded. And we always learn something new. At least I always learn something new when I hear information over and over again. All right. So now, Lydia, I'm going to call you Lydia. So let's dive right in. Tell us a little bit about just a simple definition of diabetes. What is diabetes?
Well, first of all, a lot of people know about diabetes. They've heard about diabetes for years, and the fact that it is in epidemic proportions affecting our families, and especially the African American family. I could throw out a lot of statistics, but I decided I'm not going to throw a lot of statistics out because a lot of people hear those statistics and they just go over their head. Don't mean a thing to them. But I doubt that there's anyone out there in the listening audience who has not heard the word diabetes.
Right.
And the first part of that die, it's kind of like with diet. They think that they're gonna die. And my thing is, no, you can live. You can die or be teased with all the symptoms and all the things that are going on with diabetes. And that's kind of corny, I know, to just say die or be teased, but there is a choice that has to be made by the individual who has diabetes or pre-diabetes. And there are several types of diabetes. Type 1, which some people may have heard about mostly in children, but it can also occur in adults. And that is where the individual needs insulin because the pancreas has decided to shut down. Those beta cells that secrete insulin from the pancreas, they just shut down. They may squeeze out a little bit every now and then, but it's not enough to survive. Insulin is what allows the glucose. And you hear a lot of people say sugar diabetes. It
Right.
has to do with elevated glucose levels in our bloodstream. And the insulin allows the glucose to get into the red blood cells to give us energy. And when that can happen, it builds up in our blood and a whole lot of negative things can happen. We'll talk about some of those. But that's where type 1 people who have type 1 need insulin in order to survive. And they usually get it through an IV infusion, or an insulin pump, or they get injections. And people, when you say, I'm going to give you a shot, they don't want to hear that. Okay, and that's usually what people think about when they hear diabetes. But type 2 diabetes, there is some insulin being made in the body, but it's not sufficient for the person to be able to manage their life properly and control their blood sugars properly. So they need a little extra insulin. And the problem with insulin is that it is a growth hormone. So a lot of people who take insulin tend to gain a lot of weight. Doesn't have to be that way, but they do. And a lot of people have a lot of insulin in their bodies already, but it is not able to be utilized partially because of their lifestyle. And we'll talk a little bit about that too. There is a lot that can be discussed. And then some people have heard of gestational diabetes. And this is when a woman is pregnant and she has blood tests done during pregnancy, which indicate that her blood sugar levels, her blood glucose is elevated. And this can harm her and the baby. The baby could grow too much. Remember, I said insulin is a growth hormone. So, and then they're put on insulin as well. And that baby can get very big. A lot of people may have had gestational diabetes and just didn't know it, especially if their baby weighed about 9 pounds or more. Then they are at risk for developing type 2 diabetes later on in life. And did you know that research is showing now that they're calling Alzheimer's type 3 diabetes?
I heard that. Yeah.
Mhm. So there are different things that can be done to help prevent that. And then when we talk about pre-diabetes, that is where you have a little window to work with, whereas your blood sugar levels are not quite as high as those that would diagnose you as having diabetes. But you're right there on the borderline. Okay, you're easy to cross the line and become a person with diabetes, but there are things that you can do.
Oh,
And, I just find it amazing that a lot of people maybe they're not aware of some things they can do, but we'll talk about that a little bit too. You were getting ready to say something. I'm sorry.
yeah. I was going to say when you were talking about the diabetes, in the pre-diabetes before, we went on, I wanted to ask you just to share or clarify a little bit more about the difference between pre-diabetes and diabetes.
Okay. With pre-diabetes, there is a test that's done, and a lot of people may get random blood tests done as well. But there's a test called the A1C, which is a hemoglobin A1C. It looks at the average of your blood glucose levels over the past 3 months, 3 to 4 months actually. And with diabetes, the A1C may be 6.5% or above.
Mm-hmm.
Okay. But with pre-diabetes, it may be 5.7 to 6.4. So it hasn't reached the 6.5, but it's right there at the door, waiting. And then normal is below 5.7%. So you can see that, a lot of people will check their blood sugar at home. They do the finger sticks and they check their blood sugar. That's a lot of people say, I don't want to stick my finger. I don't want to stick my finger. And they do have other ways now where you don't have to stick your finger. You can have a sensor placed so that you don't have to do that. But the key is check it. Don't lie about it. Check it. Do something about it. I have had patients in the past, and the Balm and Gilly is faith based. Okay, it's a faith based initiative for the prevention of type 2 diabetes, where we deal with a lot of prediabetes. But a lot of people in the faith based community, the first time you tell them that they have prediabetes or diabetes, they usually say, I don't claim it. I don't claim it. No, 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 no. And it's not about you claiming it. The thing is to just realize this is what has happened and you're going to do something about it. A lot of people, go through deny, shock, disbelief, deny. Remember that Kubler-Ross from
Yeah.
from nursing school, and where it wasn't specifically stated as that is kind of what happens with a lot of people when they hear the word or any diagnosis at first,
Mm-hmm.
and everything else is said is going over their head. They don't hear it, they don't want to hear it, and they don't want to do anything about it. So it may take a little time to process that and go forward. But before we go there, I just want to say too, a lot of people will check their fasting blood sugars. And fasting blood sugar is before you eat, you know, without you eating for, let's say, 8 hours at least. You've gone without food. The normal would be 99 or less. And that's usually milligrams per deciliter. But anyway, don't worry about that. Just remember the number 99.
Right, right.
Then for the pre-diabetic, the person who has pre-diabetes, theirs may be 100 to 125. However, if they have diabetes, it will be 126 or greater. Now, if somebody is just doing a random screening, like at a health fair,
Mm-hmm.
and their blood sugars are high, they cannot be diagnosed just right then. They need to have some other tests done. So I want to stress that because there are some people who are doing screenings now for the Diabetes Awareness Month. And I want
Mm-hmm.
you to know, and I want the audience to know that you just don't base diabetes on one test, especially if you have not been fasting and you just go in and
Absolutely.
you get your stick and you get a blood sugar and it's super high. You just don't go by that. But some of the symptoms, I think you wanted me to talk about that too. Hmm.
Yeah, we did. Yeah. Well, let me before and I wanted to just emphasize again, and I keep going back to the difference between the pre-diabetes because I know that you made the comment earlier that once you hear the diagnosis of pre-diabetes, people are like, but I wanted to emphasize the fact too that when you hear pre-diabetes, that's an awareness, a wake-up call, and then you can do something about it. So
Hmm.
I just wanted you to talk a little bit about that. I don't want to say just because, but if you hear pre-diabetes, does not mean that you're gonna definitely have diabetes, but that's an opportunity for you to do something about it, to make some changes.
Absolutely. And one thing that we do in our pre-diabetes classes, I usually tell my students, you can eat anything you want to. And they go like, really? Mhm. But you have to also be aware of the portions, how you
Mhm.
prepare your food, and you look at how much activity you are involving or in what's involved in your life. What are you walking? Are you dancing? Are you going to exercise regularly every day? But we recommend 150 minutes of activity a week. That's not a lot. That's a minimum. And I have some people who report to me and they have done 1,800, 2,000, whatever. They're really out there working. And I have had people who have had pre-diabetes who have reversed it. They go back to the doctor and they're no longer a pre-diabetic individual.
Yeah, that's what I wanted you to get to.
Yes,
Yeah.
because they have taken it seriously.
Hmm.
And this is why I say, are you going to die or be teased? You have been teased with all these symptoms and what have you, possibly because of your lifestyle. You have been eating whatever you want to eat. And like as you said, well, you said I could eat what I want to. Yeah, you can. But how about this? Making some changes and looking at the portions, how you're preparing your food. I don't expect you to go out there and eat fried whatever every day. You have to do things in moderation. And these habits that you have developed did not occur overnight. So you have to be willing to change your bad habits by replacing them with good habits, or else another bad habit is going to come in and take its place.
Awesome. Good point.
So
Good.
we teach people how to change their habits. And I go over something, is a little wording that I do. I work with the young people too, with a boss, building on spiritual substance program. And we take these same principles and use them when we're talking about diabetes. Repetition, easy, easy, pleasure, pleasure, often, often, habit. You start repetitiously eating the healthier foods. You start repetitiously cutting out a lot of the salt and the fat and all those things that can harm you, because we know that diabetes can lead to other complications. And
Mhm.
nobody wants to go blind. Nobody wants to lose a limb. Nobody wants to lose a kidney. Nobody wants to have any of those complications of diabetes, which can be prevented. So with my pre-diabetes classes, I, like I said, have had people who have turned the thing around. They're no longer pre-diabetic. Some of them have even gone off of their cholesterol medications,
Great.
their blood pressure medications, or gone off of them. And some of them who may have been on metformin, which is like a staple for pre-diabetes as well as diabetes, and that just helps the person to utilize their what insulin that they have better. It helps them with metabolism, the reuptake of insulin, so to speak. They have been able to come off of some of those things. But I will say, you must have a good relationship with your healthcare provider. I'm not here to give you recommendations and tell you to do this or do that, but I am here to get you to thinking and start thinking about some things that you can do in your lifestyle to take charge of your life and prevent diabetes from causing you to have a premature death.
Good. 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 Very good. And that's why we want you here. So that's awesome. So tell us about some of those things that you were going to talk about the symptoms. So let's do the signs and symptoms. And then, so we won't run out of time, talk about a little bit about what we can do to help prevent.
Okay. Okay. Well, first of all, a lot of when we talk about type 1 diabetes at first, type 2 is more prevalent. Let me just say that. And you're seeing it more in children because of their sedentary lifestyle. And what I mean by that is they sit, they don't do a whole lot of activity like we used to do when we were growing up, but they may sit and play the video games or what have you, or watch television or binge on different movies or whatever. They're not as active. So they may end up having type 2 diabetes, even though they're a child. But a lot of children with type 1, they tend to be bedwetters later in life, a lot longer than normal. Okay. And then mother takes or parent takes them to the doctor and they find out, wow, this is what's happening. But increased thirst. You just feel like you can drink a gallon of water in one sitting. You're just thirsty all the time. That is one of the symptoms of diabetes. And also frequent urination. You say, well, I drank all that water. Of course, I'm going to go pee a lot. Well, you may do that without even having taken in all of that water. It's because of all of that high glucose. It's just pulling all this stuff from your cells and you're just peeing it out. And then you start noticing also you might be losing some weight and you're not even trying to lose it. You're kind of shriveling up a little bit. Those are some things that may happen. And you seem to be extremely tired all the time. You got your 8 hours of sleep, you got your 7 hours of sleep, but you're still tired all the time. And then you may even have blurred vision. Now, those are some key things that might happen. But there are people who also look at it and they say, well, who may have diabetes and they feel like they can just tell whether they're high or whether they're low. I say, no, don't just go by that. Check it. Check your blood sugar, because some of the same symptoms for high blood sugar and low blood sugar kind of overlap. So you want to make sure that you know what is going on. For example, somebody who might be having a little low blood sugar, and you may see this sometimes, you may have, I'm sure you've seen it in your practice, but sometimes people see this at work. If they're working with somebody, they get real shaky and they get sweaty and they start getting dizzy, they get hungry. And remember, the hungry also, can come from them being just the opposite, having a high blood sugar. So that's one of those overlapping things. And then a person who has low blood sugar may get confused. They talking out of their head. They don't know. They're not really with it. Mm-hmm. So they also can feel weak and tired. That overlaps with the high blood sugar. So that's why it's so important for you to get it checked. I used to work with somebody who always blamed her grumpiness on her diabetes. I said, no, you just mean. You just plain mean. But that can happen when people are having a low blood sugar. They get very upset, nervous. They get edgy. So be patient. Are you okay? Is there something I can do to help you? Especially if you know that person has diabetes, and they may complain a lot about headaches and so forth too. So I've overlapped those things together for a purpose, because I don't want you to be saying I'm diagnosing that person has diabetes, because there can be a combination of things going on.
Right. And I like the point that you really emphasized about the fact of going on, if you know you're diabetic, going on and checking your glucose, mm-hmm. so that you'll know what it is. Because if you having some symptoms and it's one of those that overlaps, mm-hmm. and your blood sugar is low and you're thinking it's high, or it's high and you're thinking it's low, and you go eat a piece of candy because you're thinking it's low but it's really high, mm-hmm. So you want to make sure that you're doing what you know best for what the results are.
Absolutely. And I encourage anybody in the listening audience, if you have diabetes, don't second guess. Like we said, check your blood sugar and talk to your healthcare provider about what it is you should do. Because I tell folks also, honey, you are a me only, not a me too. We are more alike than we are different. But what works for me may not work for you. So you need to know your body. You need to know what works best for you. You need to know what foods work best for you. But I tell everybody, if you're having a hypoglycemic event, don't eat chocolate to raise your blood sugar. The fat in the chocolate will cause a very slow release, and next thing you know, you're going out the ceiling because you've overdone it. And it may take a lot longer for it to work And before it even works, who knows? You might be in a coma in the hospital somewhere because you didn't eat the right thing.
Yeah.
Know your own body. Know your numbers when it comes to your blood sugar, when it comes to your blood pressure, because diabetes affects that. Yes, it does. And diabetes is also, people who have high diabetes are known to have higher blood pressures, and they're at a risk for strokes and heart attacks. So it's important to have that blood sugar, that blood glucose under control. How are you going to do it? I tell everybody, there's 3 ways that the enemy defeats us, and there's 3 ways that diabetes, I look at it as an enemy. However, it can also be a positive, but that's a different story. That's a different talk. No plan and no attention to plan. You haven't planned out what you're going to do and how you're going to work with what you have. Okay, you have a diagnosis. It doesn't mean that you're dying. What are you going to do to help yourself?
Great.
You make a plan, you pay attention to the plan, you come up with action steps and objectives, and you work on it. You work with your healthcare provider, and then you stay focused on that. Stay focused on being well. And when things happen, move. Sometimes people move too slowly, and they hem and haw around. Next thing they know, it's too late. It's gotten out of control. So I tell everybody who has diabetes or any condition, you ought to have a team on your side.
Good.
Your healthcare provider is one, whether it's a nurse practitioner, PA, or a medical doctor, or OD, whatever. Your nutritionist, because I say you can eat pretty much anything you want to eat. However, moderation, and there's ways that you can prepare that. And when I say that, I don't mean for you to go out and get a ton of candy and all this junk food. No. You want to eat healthy stuff. You need to have a pharmacist. You may have an endocrinologist. That's someone who specializes in diabetes, or a diabetologist. You may have an exercise therapist, somebody who helps you to do the right exercises to help you burn up the calories that you need to burn up every day. An optometrist or ophthalmologist, so somebody can check your eyes and make sure that you're not going blind, or you're not having some issues related to your veins and your vessels that is caused by diabetes. A cardiologist, you may have a cardiologist on your team, because again, those blood vessels can be affected. The nephrologist, that's the kidney doctor. The neurologist, that's that nerve doctor. A lot of people have tingling in their hands and feet. They get numb, and it's related to diabetes.
Well, Lydia, girl, we're running out of time. We had so much to talk about. We're going to have you back. But listen, I know that you're going to be speaking at an event coming up, and I want to get that in so we can invite people to come on November the 18th, which is this Saturday.
Yeah.
South Greenville Recreation Center.
Yeah.
In room 851 on Howell Street, Greenville, North Carolina. And we're going to be talking about diabetes awareness as well. And you're going to be the featured speaker. So I know you've got some more to tell, but we put that plug in there so people can come out and listen to you. But again, I am your host, Wendy Bridges, and we are here every Thursday from 3 to 3:30 on Awesome Radio 106.9 FM. Thank you, Lydia, so much for being here.
You're welcome. And I don't know if you said the time, but it starts at 10:30 a.m.
This is Reggie Price, and I listen to Awesome Radio 106.9.